Hello everyone, my name is Lanyon and I'm joining you from Melbourne today. I'd like to acknowledge the Wurundjeri people of the Kulin Nation who are the traditional owners of the land in this area. I'd also like to pay my respects to elders past, present and emerging. So just a quick introduction for myself. I've been a mental health social worker for 13 years now. Currently, I work at Access Clinic in Brisbane, providing both individual therapy and group sessions. I'm also based at the Psychiatric Inpatient Unit at St Vincent's Hospital in Melbourne. So I work across both states. Today we'll be talking about vicarious trauma. These days, anyone who has social media is at risk of being exposed to vicarious trauma, but lawyers are particularly vulnerable. The nature of your work necessitates deep involvement in cases where people disclose violence, harm, grief, loss and danger. Your job requires you to sit with people for hours recounting the worst days of their lives. In some respects, it is good if you feel things because that emotional response means you're not a sociopath. Having said this, we do need to find ways for you to be safe at work. Before we get started, I'd like to touch on safety. Today's presentation contains discussion of mental illness and trauma. There will not be a graphic discussion of any of these topics. However, if you do experience discomfort, please feel free to pause the session, come back to it later if it feels safe. Use your 5 senses to ground yourself. Write down your thoughts and emotions in a journal or find someone to talk to and vent your feelings. In today's session, we'll be looking at the definitions of vicarious trauma, symptoms, causes, risk factors, and then the second part of the session will be around what you can do to protect yourself and interventions to use if things get out of hand. So what is vicarious trauma? It was first identified in the 1980s as the cost of caring. It's sometimes referred to as compassion fatigue and burnout, and symptoms can parallel those of PTSD. In 2013, the Diagnostic and Statistical Manual of Mental Disorders included indirect occupational exposure as a viable criterion for PTSD. Today, vicarious trauma is a term used to describe a range of cumulative and harmful symptoms that develop in response to exposure to other people's trauma. And this can be reading, watching, and listening to sensitive and complex material. It can be so profound that it has the same harmful effect on our mental health as experiencing the trauma directly. So why is vicarious trauma so prevalent in the legal sector? There has been increased scrutiny of occupations that less obviously experience adverse impacts. The legal profession is definitely one of these. Lawyers are repeatedly exposed to graphic, photographic evidence or witness accounts and narratives of traumatic events, accompanied by heightened levels of emotion and distress from clients. Family lawyers work with people subjected to domestic violence. Criminal lawyers deal with violent crimes, including child exploitation. And immigration lawyers work with separated families. The list is varied and endless. There have been several studies in Australia into the well-being of the legal sector. The most widely publicised of these was released by the Brain and Mind Research Institute in 2009. So after surveying 741 students, 924 solicitors and 756 barristers, the Institute found that 31% of solicitors and 16% of barristers suffered from high or very high distress levels, and this was severe enough to warrant clinical assessment. Some of the common symptoms of vicarious trauma include invasive thoughts of a client's situation, frustration, fear, anxiety, irritability, disturbed sleep, nightmares, racing thoughts, problems managing personal boundaries, taking on too great a sense of responsibility at work, having trouble switching off from work, loss of connection with yourself and others, withdrawing from others, increased need to control events and outcomes, loss of pleasure in daily activities, low job satisfaction, feeling frustrated by or judgmental of your clients, feeling under pressure, powerless and overwhelmed, not taking breaks and eating on the run, unable to properly refuel and regenerate on your weekends, frequent sick days, irritability and anger, and hyper-arousal to your safety and the safety of loved ones, avoiding physical intimacy, having an increasingly pessimistic worldview. I do just want to note though that vicarious trauma doesn't necessarily lead to mental illness. However, it does put you at higher risk of developing anxiety and depression, and sort of falling into alcohol and drug misuse. If you do find yourself experiencing these symptoms, it's important to recognise that this is not a reflection on your professional abilities, but a really normal response to the challenging nature of the work that you do. There's certain things that do put you at higher risk of vicarious trauma. So unexpected or repeated exposure, personal history of trauma, such as childhood adversity, heightened empathy, trouble recognising your own emotions, lack of support at work, social isolation, both on and off the job, a tendency to avoid feelings or assign blame to others, difficulty expressing feelings, lack of preparation, orientation, training and supervision, and being newer employees and less experienced makes you more vulnerable. On the other side, it's worth mentioning that some people are inherently more resilient to secondary trauma due to personal traits such as conscientiousness, which allows them to overcome feelings of despair or hopelessness that may arise when dealing with a trauma victim. Insight is also a protective factor. So our minds are thought processing machines, creating and sifting through as many as 60,000 thoughts and ideas in any given day. So automatic thoughts have the potential to trigger intense negative emotions. So having an awareness of these thoughts and catching them before they get under our skin allows us to better understand and deal with the associated emotions, modulating them before they get too intense and too overwhelming. Now, what can we do to protect ourselves? So on an individual level, monitor yourself, eat well, rest, exercise. I know it seems obvious, but it works. Focus on self-care, seek balance, engage in well-being practices such as meditation, exercise, yoga. For me, it's surfing. Set professional and personal boundaries. Don't take traumatic files home, or at least designate a specific room in your house for working on those files so that distressing content is physically and emotionally separated from your personal spaces. Take advantage of professional development. Use viable evidence-based treatments for vicarious trauma that focus on changes in cognitive processes. Watch for symptoms. Talk about your feelings. And take regular breaks when reading distressing content. On a collegial level, where a colleague appears to be at risk, confronting them can worsen the potential effects of the trauma if not approached in a really careful and gentle manner. So first of all, gauge whether the support is wanted and initiate any discussions in private, not in public. Offer stress busters to do together, a quick walk, making a cuppa, stretching, deep breathing, practice active and deep listening, really paying attention to your body language, and validate feelings and use affirming statements such as, oh, it feels like there's some deep sadness you're experiencing right now. Lastly, on an organisational level, we can reduce systemic causes by monitoring staff workload, assess risk and potential hazards before exposing staff to challenging cases. If need, mark files with a warning or restrict access, provide critical incident debriefing, offer EAP to your staff, and provide professional education where possible. And I've just added some resources in here. So Phoenix Australia is one of the leading experts in vicarious trauma. So there's a lot of great education options there and options for consultation. Insight Timer is a fantastic free app that has a lot of exercises for relaxation and mindfulness. In terms of EAP, staff can access up to 3 sessions, which are covered by EAP. Group debriefing and supervision within your organisation, trauma-informed and trauma-sensitive yoga. There's a lot of evidence behind this, so find something local to you. Natural support, so tap into your friends and family or your pet if that works for you. Lifeline and 1800 Respect are great for after hours. Trauma therapy such as eye movement desensitization reprocessing are fantastic, and a lot of the clinicians at Access Clinic actually do EMDR. Talk to your GP, get a mental health care plan if need be, and I've also included my contact details in case there's anything specific that has been brought up from today, or if you've got any more questions. Okay, so that's all from me today. I do hope that you found this helpful, and thank you for your time.